truthfully, the best things that you can do to take care of your skin are to take care of your overall health. Keep your stress down, sleep well, eat well, hydrate well, and of course, protect yourself, from UV damage and, a lot of the poisons that exist kind of around us, right?
Welcome to the CareMedica Elite Wellness Podcast. On this episode, we sit down with Dr. Laura Taylor, board-certified pathologist and dermatologist.
So hello everyone, welcome to another episode of CareMedica Elite Wellbeing Podcast. Today we have with us Dr. Laura Taylor. She's beautiful besides everything else, I just have to add that. And she has so many degrees that I didn't even wrote all of them down, but I'm gonna have her introduce herself and talk a little bit about herself and what she does and the reason why she's here today. So Laura, please.
Absolutely. So I did 2 residencies and 2 fellowships. So I started out in anatomic pathology at UPenn. So my approach to medicine is a little bit different than most doctors because I, really think about things on the cellular level first. And so anatomic pathology is essentially, the study of tissue. So if people have a biopsy done, for example, where you have the nerds in the basement that read it out. But what a lot of people don't know is pathologists also manage the labs in the hospital. So, I also spent time in the blood bank and in molecular and those areas as well. I then did a fellowship in dermatopathology, which is specifically looking at skin. And actually had the privilege of writing a textbook with Misha Rosenbach, who is, aside from being a genius, is the head of dermatology at UPenn, their residency program. And then I went on to do my dermatology training under Jeffrey Callan, who is really the father of medical derm, and then my Mohs micrographic surgery fellowship in dermatologic oncology with Dr. Greenway, who trained under Dr. Mohs.
So basically, you have your curricula is like,
I love to learn.
Yes, and being so young.
That's very kind.
How did this passion? I mean, how did the whole started? How the beginnings?
The beginnings, watching my father. So my father's a physician, and I've never met anyone as passionate about medicine and patient care as he is. And so, I watched him build, his practice. He had a heart attack when he was 40. And basically from his hospital bed made the decision that the way traditional medicine worked was killing him and his patients. And so he wanted to create a better way. And he has spent his entire career doing exactly that. And so, I think there was just always the standard of excellence that, I aspire to. And I'll never be him, but I will always be incredibly grateful for the lessons that I've learned from watching him.
So that is amazing. What I find really amazing is to find somebody young like yourself, but with all this passion inside. And, sometimes we get students here, right, that comes to residency or whatever they do in some internships. And what I tell them, I always say, you need to study. You need to, be interested. Understand what's going on. The more you know, the more you will be able to give to other people. So That's true. Find that really amazing. We're going to talk about your practice in a minute, but actually, before you came today, we sent your resume and we sent your story to some of our elite patients, and they sent us some questions.
Wonderful.
So the questions that I'm going to ask you, some of them I wrote myself, but some come from the patients. So, all right. So let's see question number 1.
Okay.
Part of it you answered already. Tell us about your journey into dermatology. What inspired you? You said it, your dad. But I think there's a little bit something there with with what you're doing right now, right?
Yeah, absolutely. So I think what inspired me about dermatology specifically is a little bit different. I started out in pathology. And the reason that, they call it the doctor's doctor, right? But what I loved about specifically liver pathology, which is actually what I went to Penn to do,
Wow. Okay.
was how interdisciplinary it is. So, you have these conferences where you have the pathologist and the clinician and the surgeon sitting together, looking at the slides and having a discussion about the person and their life, and who they are and what they're doing, and also kind of what's happening at the cellular level as well. So we call this clinical pathologic correlation. So what's happening on the slide and what's happening in front of you. That's what I fell in love with. And it's very funny because there was a rotation at Penn, which was called derm, liver, kidney. And the only reason that it was called that because it had to do with matching sign-out times. And so the reasons that I went to Penn for liver were the reasons that I fell in love with derm. But the thing about derm is I can see your skin. I can't see your liver. And so the ability to just look at you and be without any other tests and be able to read what's happening inside your body was so exciting. And so that's really what ended up drawing me to dermatology.
Wow. Okay. Well, that's amazing. I have another question over here. One of my patients wants to know, why will patients internationally come to see you? Mm-hmm. What kind of services or expertise are there in your practice that are not in any other practice?
So I think one of the main reasons is trust.
Okay.
I think that's the biggest thing. The standard of excellence that I hold myself to is also what I hold everyone around me to as well. And so every single doctor is very carefully selected, not only for their knowledge, but also for their bedside manner, for their understanding of the human condition, right? And so that's just as important to me.
Which does make a difference.
It makes a huge difference because I can give you the best advice in the world, but if you don't understand me, if we don't have a relationship,
well, the trust is really important.
It's the trust. It all comes down to trust. I think the other reason, which is a more practical reason, is that Mohs surgery is really an American technique. So, it's a technique that was designed to remove skin cancer. So what we actually do is, on most of your body, if you were to take a normal margin, which means that we'd say in most cases, if we remove this much tissue around the tumor, mm-hmm. we'll get it out. So in most cases, you don't have to go back. That'll be enough. But you have prime real estate on your nose or your ear or, yes. anywhere like that where you don't want to take anything extra. You want it to be very precise. And so what this technique allows us to do is to do that and process the tissue at the same time. So we're able to look at 100% of the margin. So we're looking to make sure there isn't a single cancer cell left before we continue. And if there is, we know exactly what we're chasing.
So basically, when a patient comes and has one of these conditions and you are doing the procedures, you are able to remove exactly what you need to remove.
Exactly.
And examine it, while you're doing it, examine it and then make sure there is zero left.
Exactly.
When you remove like a tumor.
Exactly. Okay. So it's the one time for me where a patient comes in with cancer, we're able to look at it, cut it out, confirm under the microscope it's gone, and then send them on their way.
Send them on. Oh, that's great. Many people associate dermatology, that's the question, mm-hmm. primarily with cosmetic procedures. Mm-hmm. So how much of your practice is actually dedicated to preventing and treating serious medical conditions, and how much is dedicated to cosmetic procedures?
So I think that there's a common misconception that health and wellness or health and beauty are different things. But a lot of the things that people go to dermatologists or med spas or buy creams for are actually caused by things that are happening on the inside. Mm-hmm. They're just an expression of actual medical conditions. A lot of times it's hormones. A lot of times it's inflammation. So, our body, the highest concentration of immune cells is within our gut. The second highest is our skin, right? And so I would say that pretty much any reason that somebody goes because they feel like their skin is looking dull, or that they're aging in a way that they're displeased with, a lot of that is UV damage. It's damage from the environment around us. It's something called epigenetics, which is essentially we have our genetics that are programmed, but the epigenetics is everything else that happens to and around us.
So the skin is a mirror of your health?
The skin is absolutely a mirror of your health. And that's why I like to make the point that I don't just want to put a cream on it. I don't just want to run a laser over it. I want to actually figure out what we need to do so that when we're doing those things as additive, but we're also dealing with what's happening inside.
And this is very interesting because actually a lot of my patients that come to the clinic and they will say, oh, I went to my dermatologist, I just got this burned out and this and that, and they did a little less, but actually dermatologists go deep enough to understand really what are they removing or what it is? So I think that this is really something key actually over here. Okay, doc. So what are the biggest misconceptions people have about the skin health? We have so over here is like
so
many.
There's so many. The biggest, I don't even know. I would say that you need to buy fancy creams and expensive procedures in order to take care of your skin. And truthfully, the best things that you can do to take care of your skin are to take care of your overall health. Keep your stress down, sleep well, eat well, hydrate well, and of course, protect yourself, from UV damage and, a lot of the poisons that exist kind of around us, right?
Do you use creams?
Of course.
What's your routine? Let's see.
So my routine is not going to be your routine.
Okay. Hopefully not.
Hopefully not, right? And so I think that's kind of part of the point.
I want to look like you, yes.
No, but even so, I'm a minimalist. I could never adhere to a 12-step routine, nor do I think it's good for your skin. The most important thing is microbiome balancing, to be really, really conscious about kind of using things that are gentle on our skin. To avoid things, it sounds like common sense, but to avoid things that are irritating or overly stripping, and to listen to our skin. So in terms of a particular brand, a lot of that's personal choice. But what I care about is the sunscreen. So, making sure that you have a sunscreen that is going to properly protect you and that you understand how to apply it correctly. Most of us are not doing those two things.
Okay. Advanced technology for skin cancer detection. So one of the reasons why we wanted to talk to you today was actually that particular subject. So what is skin cancer actually? And it has become increasingly common into patients, which I think it is. I hear so many patients that have issues.
Yes. So there's many types of skin cancer. That's the first thing to kind of to talk about. There's two main categories that we put them into, which is melanoma and then non-melanoma skin cancers, which are much more common. And those are typically your basal cell carcinomas and your squamous cell carcinomas. Primarily caused by UV damage, so largely preventable. And a lot of misconception around kind of what exactly is the cause. Some people have blamed sunscreen. There's a lot of debate over kind of chemical versus mineral sunscreen. But the reality is that, it is caused by UV damage, which comes from the sun. And there's two main forms of UV. There's UVA and UVB, and both are cancer causing. A typically causes more aging. We think of A for aging because it goes deeper. So it's also going to break up your collagen and destroy your collagen. But it's also, a major cause of cancer. UVB is what generally is more surface level, and that's what causes more of the burning. In both cases, however, when skin cancer forms, it's very important to treat it early. Okay, because the longer it's there, the depending on the type, it can metastasize. So certain types of skin cancer can go inside. Certain types of skin cancer can be fatal, especially melanomas and advanced squamous cell carcinomas. So if you or anyone in your family has had a skin cancer, it's really important to be extra diligent in terms of getting full body skin exams. And so what we do that's quite different is that we do full body photography on all of our patients, which is something that typically is reserved at cancer centers for patients that have already had a series of atypical nevi or melanomas. And the reason we do this is because I had an early melanoma when I was in my training.
Oh.
And I was told it was fine, not to worry about it. We biopsied it because, I said, if I'm looking at it, we should take a look. And it was an early melanoma. And what was really jarring to me about that experience was that I couldn't remember if it was there. And, we ask patients all the time, how long has that spot been on you? And I couldn't understand how they didn't know until it was my body, and I didn't know.
But also, it could be that you have a spot in the back and nobody's checking it.
All the time.
It's like you can see your face in the mirror. Sometimes it's not easy to find.
Absolutely. And, a lot of times those spots are found by people's spouses. I call it the Sharpie test, where I get patients that'll come in and their spouse has literally taken a Sharpie to their back and said, here, look at these spots. These are the ones I'm worried about.
Also, I was reading something about the vitamin D, right? So, in order to get vitamin D, you need to expose yourself. You need to get sun.
Mm-hmm.
And so, if the sun is bad, or you should not be exposed to the sun, so how do you go about, have enough vitamin D in your body from sun exposure? So,
I don't like thinking about things as good or bad. If you drink too much water, you can literally drown yourself internally, right? But that doesn't mean water's bad.
Of course.
So the thing about the sun is there's a lot of benefits from the sun in terms of balancing our circadian rhythm. There's a lot of evidence about, the first thing in the morning, helping to set the tone of your day, to get that sun. The reality is that I'm not advocating for you to go out and bathe in the sun, right? We get so much sun exposure in our day-to-day lives that we don't even realize when we're walking to our cars, when we're driving in our cars, sitting in front of a window. So, what's important is to make sure that you are protected and that you get your labs tested, right? And that you supplement when need be. But, most of us have a variety of deficiencies from our diet that we need to be focused on. And I think vitamin D gets a lot of attention because a lot of us are deficient in vitamin D. But I also think it gets a lot of attention because there's debate over whether or not sunscreen should be worn, and that is not a debate that should be had.
Well, also, for example, you say, if I'm driving, I'm completely dressed. So the only probably part of my body that is going to be exposed is maybe my face. So if I take my jacket off, maybe my arms. But so what would be like? Imagine I will be playing outside in my shorts. Or, mm-hmm. Running, no shirt. What would be enough time to get enough vitamin D from the sun exposure without having to be worried? So
I don't think you should ever be worried. I think you should look at your own data, right, with your doctor and see. It's going to be different for different people, and I don't know what the exact minute-to-minute amount.
I'm sorry, they used to say that you should get your face red. And when you touch it and whatever.
I've never heard that, but I would.
Oh yes, I read this paper actually. I'm going to look for it.
Yeah, send it to me.
It said that 15 minutes you should be exposed at least 15 minutes and make sure that you get the first red and then get out of the sun.
So
I don't know.
So I would have to say no to that because red is really your body's response. It's like a warning response, saying that you've been in the sun too long. And the time for me to get red and the time for you to get red is very different, right? Mm-hmm. And so, there's skin cancer comes about. Some kinds come from cumulative sun exposure, which means that if you add up all the time in your life that you're exposed to the sun, mm-hmm. and other types come from getting really bad sunburns, right? In terms of your risk factors. So I think that the most important thing is to protect yourself. Be aware of the UV index. How much sun are you getting when you're outside? It's different at different points in the day. It's different at different places on Earth, right? And to make sure that you are doing a combination of wearing sun protective clothing as well as appropriate sunscreen that you are reapplying.
Well, this question is an easy question, but I will ask you anyway. So who should be screened for skin cancer?
Yeah, so we should all have a baseline, and then we should all be regularly screened. You don't know what you don't know, and you can't see what you can't see, right? And so leaving that up to an expert also allows you to relax, right? And have someone that when there is a question, you don't want to have to first go on that journey of trying to find someone and get in. Unfortunately, there is a large shortage of dermatologists in the country, and there can be a very long wait. So having a dermatologist and a relationship established before there's a problem is also very important.
Let's recommend, okay. And you said you use this advanced imaging technology in your office. It's something that not many offices will have. I think you're probably one of the first. Without going too much into details, can you explain a little bit?
Yeah, absolutely. So what it does is it's like a giant camera, and it creates essentially an avatar of you. So, and then it will map out all of the spots that are on your body. I think our record is around 3,760 spots.
Wow. Okay,
yeah.
That's an amazing number. Okay.
And so then what we'll do, it will alert us based on AI algorithms to spots that it is worried about based on different parameters we can set. And this is just a nice way to also follow things. So, what I am concerned about, what you are concerned about, and what the machine is concerned about may not all overlap, but it gives us kind of 3 points to kind of look at, right?
Okay.
And then what's nice is that we have a special machine called a dermatoscope, which is essentially a fancy magnifier that can take pictures at very high resolution.
Okay.
And so this actually allows us to be much more comfortable making decisions where previously we would have had to do a biopsy. So it minimizes how many biopsies we do in our office while improving our ability to monitor things. And when you come back the next time, it will actually overlay your images for us and let us know what has changed before we even look at you.
Wow, that's amazing. Wow, okay. Well, of course, can these technologies detect melanoma before changes become obvious?
Yes.
Yes, absolutely yes.
But I think the other thing that's important is, even more so than the technology, is the time that we spend. So our exams for your annual, we spend an hour with you. Our skin check is slow. And so to me, the machine's very valuable, but really what's most valuable is the time. Because we really are able to look everywhere and to take the time to answer your questions.
So you will say that once a year is probably the time that is set for, or of course, if you have issues, you should come back earlier before.
So the way that we work
is
pretty unique, in which case your initial exam, we do a risk assessment. And so we look through your history, your family history, we do your full body skin exam, and then we put you into a risk category. And then based on that category, we will recommend essentially how frequently you should see us. Of course, you're always welcome to see us more than that, but that's essentially how we structure things.
Well, that is great. Also, because everything is personalized.
Everything's personalized.
That is absolutely amazing.
Yeah.
So your skin is a window to your overall health and longevity. This is something that last time we spoke, we said that, and this is. Longevity is a word that everybody uses today. So today everything is longevity. Even, cereals, when you go buy the cereals, is longevity.
Yeah.
But so what is the relationship between really, skin health, not only, but the attention, of course, to the longevity, of course, you want to find out if something is happening, but how do you put longevity into what you do? Into your skincare, into your exams, what your patients are looking for?
Yeah. So That's a great question because I think it is a word that we use a lot, and it doesn't really have a defined meaning. Nor does a longevity doctor. There is no such thing as a longevity doctor. So when I think about longevity, I think about, optimizing health, right? So how long can you be in the healthiest, most vital state of your life, right? And at every single phase of your life, you want to be able to optimize for where you are. So when you're 60, we're not looking for you to be 20, right? We're looking for you to be the best version of yourself at 60, right? You may mentally be 20, right?
Yes.
But I think that's a really important point, is that with age comes great privilege and wisdom. And so we're not looking to anti-age people. We are looking to help people age well. And so your skin being a window into your internal health is an essential biomarker, to be able to help us see kind of how are these different interventions working, how are you doing, and to make sure that we're calibrating for both. We have an outside in and an inside out approach.
So we are going to age, we're going to get old,
of course,
but we want to get old being healthy.
Yes.
So basically, that's the key, right?
That is the key.
And your skin, our skin reflects your overall health.
Mm-hmm.
So, okay. What are the diseases that often show the earliest sign of detection, right?
Mm-hmm.
So what are the diseases that can be detected, by looking at your skin, for example?
Yeah, so hormone changes is something that you definitely can see in your hair and your skin quality. There's a lot of attention right now to perimenopause and menopause and women's health, and that is something that we see evidence of in the hair and skin. And so many of the reason that women come in to see us is actually related to their hormones, which is what has inspired us to become an interdisciplinary practice.
Okay.
So we have brought in female physicians that are experts in various different areas, from GI to cardiology, to reproductive endocrinology, to gynecology, with an emphasis on hormonal health, for that very reason. Another thing that's really underdiagnosed or has a very delayed diagnosis, especially in women, is autoimmune disease. And a lot of that, we will diagnose in the skin before it's diagnosed elsewhere.
Wow.
And that goes back to the understanding of where your immune cells are. So immune cells primarily in your gut, which you can't see, but and the skin. And so actually looking at people's fingernails can be very, very helpful in terms of diagnosing underlying autoimmune disease.
Wow. Okay. One question that was sent to us, it says, can you estimate a person's biological age by examining the health and quality of their skin?
Not in isolation.
Okay.
So what you can, there's a lot of these devices where it'll take a bunch of photos, and then it'll tell you your biologic age and your chronologic age, and those are fun. But to actually look at your biologic age, you need to do a lot of testing, mostly in the genomic realm. So, and we work with a molecular geneticist. So, for patients that are interested in more extensive testing, that are interested in, really a lot of the things done in biohacking are complete pseudoscience, rooted in a kernel of truth, right? There's a kernel of truth in there. And so, getting to that kernel of truth and actually being able to look at things on a cellular level, that's something that I'm very interested in educating people and helping people do, because there's so much kind of preying on people's desire to be young, to sell them things, that upsets me.
Yeah, that's a bad part of that's marketing and comms.
Yeah.
Yes.
Very effective at the marketing side, but not so effective at the...
Well,
Yeah.
people want to buy what they think they're going to make them young, they're going to look better, or whatever. So
with a little less integrity, I'd be very, very rich. But
absolutely agree with you 100%. Okay, what lifestyle habits accelerate skin aging?
Well, I think the main one is, exposure to the sun,
Sun exposure.
and stress.
How about smoking?
Smoking also.
Oh.
My favorite thing about smoking is the anti-smoking campaigns, right? So there's so many campaigns that went out about, lung cancer and the risks around smoking, and they didn't really have much of an effect. You know what really worked? Exactly. When they started showing the wrinkly
stopped
older
smoking
women,
immediately.
with all the lines around their mouths.
That's it.
That's what gets people. So you know what? I'll take it. Whatever inspires you to stop.
Also, which is a good point here, poor nutrition and sleep deprivation. People don't sleep well, but I think it's correlated with many other things, stress, whatever it is. But,
Exactly. It's all related.
well, this is a question, we actually, a lot of our patients ask this question, but I think you answered it. How important is sunscreen, not only for preventing wrinkles, but also for reducing the risk of skin cancer? I think you've said it before, but
I think the one thing that I'll add there is UVA blockade is especially important for anti-aging, right? As we talked about how UVA goes
UVA,
deeper.
yes.
Now, in the US, we use SPF as our measurement predominantly on sunscreen. That is only a measure of UVB. So you could have 100 SPF and have no UVA coverage.
I have no coverage.
So, Europe and Asia do it much better because they actually will give you the SPF, which is your measurement of UVB, and they'll also give you your measurement of UVA. So, I could do a whole talk just on kind of ingredients in sunscreen, but unfortunately, we actually don't have access to a lot of the filters that are better for UVA coverage here in the States. We actually just got one approved, the first one since 1999.
Wow.
And that one has been in use across the world for decades. So we're behind.
I grew up with Coppertone. So.
Yeah.
Okay, so we also touched this, but I'm going to ask again. Are expensive skincare products necessarily better than more affordable options?
So it very much depends on the ingredients. Some ingredients are worth investing in, and other ones are not. And so that's something that we cover in our consults.
Yes. Okay, let's see. Patients really sent a lot of questions over here. So how does chronic inflammation affect the skin?
Excellent question.
And what role does inflammation play in the aging process?
Excellent questions.
All right.
Yeah, so
There you go.
you have some very smart patients. I like it.
This is my question.
That one was yours. Okay. Then you're very smart.
Since you said it was a good question, I'll take the credit.
Yeah, so inflammation definitely plays a role in both. Anytime that you are breaking down, kind of aspects or the balance of the skin, you're affecting its structural integrity. You're going to see signs of aging, right? So I think that the most important thing that we can do whenever there's inflammation is get to the underlying cause of what that is. The other thing to be aware of is that chronic inflammation can lead to cancer.
Yes,
this is especially important to discuss in women because a lot of women have what we call vulvar dermatitis, which is inflammation of the skin in the genital area. And some women are embarrassed to talk about this, but it's very, very important to talk about this either with your dermatologist or your gynecologist, or ideally with both, because chronic inflammation in these areas lead to cancers that are not discovered until they're much more advanced than they need to be, just because it's not routinely asked or discussed. So if there's any question at all, please ask your doctor about it.
So prevention is really starting to take a steps right now. Years back, nobody wanted to talk about prevention. So do you feel like we are doing better today as far as like cases of skin cancer? And
so that's a very interesting question. So it depends how you measure it. I think that if you look at the number of skin cancers, it actually looks like skin cancer is going up dramatically. But I would argue that's because we're doing a better job of detecting them early. So anytime you have a more sensitive test, you're going to see more positive things, right? But if you're looking at, are we seeing more early cancers or are we seeing more late cancers? We're seeing more early cancers. And so that's wonderful because
So prevention, it is.
So it's prevention and early detection. Those are really key. I think prevention has always been the focus of medicine. That's always our goal, is to avoid the problems. It's just very hard when you live in a world where there's already so much disease that exists.
So, well, you are a specialist, so hopefully when a patient comes to you, they are coming already because somebody have referred them or whatever it is. But what I notice is that actually, I don't know if something that happens locally more here in Florida, patients, it's hard to get the patients in the clinic. It's hard to get them.
Yeah.
If you tell them, listen, I think this is something that you should look into it. Oh, okay. I'll call you. So do you find this the same?
It's very interesting. Yes. I think things are in extremes. I have patients that are, in their 30s and like the pinnacle of health, and they're the ones that are showing up to do all the tests. And they're very interested in understanding all their numbers and all of this, and that's wonderful. They're very proactive. I think that there's a lot of people that put their health on the back burner. You have a lot of people here that are very high achieving, very successful, very busy, and until something's really wrong, they don't make the time for it. Every single patient that I have that has had something wrong makes the time for it going forward, and they wish that they had made the time for it before. Yeah. So if people take one thing away from this conversation, I hope it's to establish relationships with doctors that you trust and do the preventative work.
Okay. And I think we have the last question over here. How does hormonal health influence the skin as we age?
Yeah, absolutely. So it has a dramatic effect, and the effects are different in men and women as the hormone shifts are different. However, one of the most common reasons people come in and don't realize is a hormone issue is their hair. So both men and women, as they age, your hair's great. We have something called androgenetic alopecia. And so what ends up happening in men is you get the receding hairline, right? And in women, you get the widening part. Both of those are related to hormones. And so when we have patients come in talking about hair, hormones is always one of the first things that we look at. And then in addition to that, we have a bunch of different treatments that we can do. The thing about hair as well is prevention is key. It is much easier to keep your hair than to get new hair, right? So we gotta start you early, So that's probably the most common.
Any correlation with the GLP-1s today? I know it's
that's also a wonderful question.
Difficult subject, but
it's a really important question. So thank you. So lots of people are on GLPs, which it's actually a medicine that has a tremendous amount of benefit even outside of losing weight. We're seeing benefits also in terms of cancer prevention and outcomes as well. But it does come with side effects. And the side effects are predominantly going to be things like shifts in your body composition. So what you don't want is you don't want to lose muscle when you're trying to lose fat, right? The other thing is that you don't really get to choose the fat you lose. And some of the fat is good fat. So what people come in for when they want filler, et cetera, is essentially we have fat pads here. That's what keeps us looking young, is it's actually your fat. And so if you lose weight too quickly, those are the first ones to go. And that's why people get the Ozempic face or the sunken in look. And so it's really important to be able to balance what's happening in your physical appearance, and what's happening inside as you're using these GLPs. The other thing is your diet. So when you're eating less, everything you eat becomes so much more important. And so if you're not getting enough protein, that's also going to cause you to lose hair. So we have a lot of hair loss patients. And then we also, have a lot of patients that come to us, kind of with that sunken look. So we have a whole protocol. So we actually will either work with people's primary cares, or we do have doctors that will put people on the GLPs. But we are doing DEXA scans. We are checking your hormones before we set your dose. And we're actually doing hair loss prevention and skin laxity prevention along the way. And if you didn't have the benefit of doing that when you did your GLP, don't worry, we can still help you out now.
Oh my God. So we will have another 2,000 questions for you. But I think that I like what you said before. So we can make this like a once a month appointment, and we discuss other issues. We had Dr. Taylor here. I don't even know how to thank you. You've been so great. And
this was fun.
This has been a great conversation. Again, there is so much more. I had a whole bunch of other questions, but so for today, we are okay. And thank you so much.
Absolutely.
For your
Thank
time,
you.
because you came. She has a great practice in Palm Beach, West Palm Beach,
West
correct?
Palm.
And we are going to put all the indications, the address, the website in the podcast. You will get copies of it, and we're going to love it. We're going to send it to everybody, and we'll be doing great.
Absolutely.
Thank you so much, Laura.
Absolutely. It's my
much.
pleasure.
Are you interested in learning more about dermatologic and regenerative aesthetic treatments? You can schedule an appointment with Dr. Taylor by visiting dermhealthpalmbeach.com or by calling 561-323-6009.